Today we will discuss opioid withdrawal, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Opioid withdrawal is what happens when someone who has been using opioid drugs, like prescription painkillers or heroin, stops using them suddenly or reduces their dose. The body can become dependent on opioids, so when they are taken away, it can cause uncomfortable and painful symptoms. Common symptoms of opioid withdrawal. Physical symptoms: muscle aches, sweating, chills, nausea and vomiting, runny nose, yawning, increased heart rate. Emotional symptoms: anxiety or restlessness, irritability, depression, trouble sleeping. How to know if you're experiencing withdrawal. Timing: if you've stopped using opioids after regular use, symptoms can start within a few hours to a couple of days, depending on the type of opioid. Intensity of symptoms: if you notice several of the symptoms listed above and they feel intense or overwhelming, it may indicate withdrawal. Past use: if you have a history of using opioids and have recently decreased or stopped, it's more likely you're experiencing withdrawal. If you think you might be going through opioid withdrawal, it's important to reach out for help. Medical professionals can provide support and treatment options to make the process safer and more manageable. In the hospital, if someone is going through opioid withdrawal, they typically do the following. 1. Assessment. Doctors check the person's health and withdrawal symptoms. 2. Medication. They may give medications to help reduce withdrawal symptoms. These could include omethadone or buprenorphine. These are used to ease withdrawal and cravings. Oclonidine. This can help with anxiety and sweating. 3. Hydration. They ensure the person stays hydrated, sometimes giving fluids through an IV if needed. 4. Supportive care. Nurses provide comfort, monitor vital signs, and help with any physical or emotional needs. 5. Counseling. They may offer mental health support or connect the person with counselors for further help. 6. Planning for recovery. Before leaving, they help set up a plan for ongoing treatment and support after discharge. The goal is to make the person safe and comfortable while they recover from withdrawal. Here are some specific medications commonly used to treat opioid withdrawal. Methadone, a long-acting opioid that helps reduce withdrawal symptoms and cravings. Buprenorphine, a partial opioid agonist that can help ease withdrawal symptoms while also reducing cravings. It is often combined with naloxone, Suboxone, to prevent misuse. An alpha-2 adrenergic agonist that helps alleviate symptoms like anxiety, sweating, and restlessness. An opioid antagonist that can help prevent relapse after detoxification, but it's not used during active withdrawal due to its potential to precipitate withdrawal. An over-the-counter medication used to treat diarrhea, which can be a symptom of withdrawal. Sometimes used to help with anxiety and insomnia during withdrawal. These medications are typically administered under medical supervision to ensure safety and effectiveness. People at an increased risk of developing opioid withdrawal include 1. Regular users. Those who take opioids daily, especially for a long time, are more likely to become dependent. 2. High doses. People who take large amounts of opioids are at greater risk. 3. Mixing substances. Individuals who use opioids along with other drugs or alcohol may develop dependence faster. 4. Previous withdrawal. Anyone who has gone through withdrawal before may be more likely to experience it again. 5. Mental health issues. People with anxiety, depression, or other mental health problems may find it harder to stop using opioids. 6. Lack of support. Those who don't have a strong support system or access to treatment may struggle more with withdrawal. 7. Young adults. Younger people might be more susceptible due to risk-taking behaviors. Understanding these factors can help identify individuals who might be at risk and encourage them to seek help. Now you need to watch my video on strokes or have a look at heart attacks.